Senior A&E doctors are warning that hospitals are teetering on the edge of safety. The Royal College of Emergency Medicine says that after a quieter start to the year, the pressure has intensified this month. And if there's a severe cold spell, patients will endure even longer waits. NHS England says fewer people than last year are spending long periods in hospital. Our health editor Hugh Pym has had unrestricted access to Royal Bournemouth Hospital, which serves one of the largest elderly populations in England.
We have had 19 ambulances since midnight last night.
What's your ETA, please?
I have a phone that rings constantly.
Cheers now, bye-bye. I did hear them say they don't have any beds.
Got staffing issues throughout.
Are you still comfortable?
I don't know how long I've got to wait.
The longest wait to be seen is 3 hours and 8 minutes.
The feeling is frustration.
It's busy, but there is flow today, which is quite nice.
Their job is to treat the sick, but just as important is what they call flow.
In ED at the current time, we have one patient in resus.
Getting people through the hospital.
This is 3 days now we've waited for a bed there.
Ward 5 is full, Ward 9 are currently full.
Finding enough beds for the patients who keep on coming.
We were starting to struggle to offload and the length of wait had gone up as long as it had.
Behind the scenes, these meetings are crucial.
Over the Christmas period, the numbers are increasing, the ambulance arrivals are increasing.
While the meetings continue, meet Donald.
Going to be a famous man.
96, in for a fractured wrist.
This chap's got what we call a Colles fracture.
We're going to put some anaesthesia here and we're going to manipulate that it's straight.
There's someone doing counter traction on the back of his arm. There'll be someone pulling onto his wrist to get the brake into a good position.
Donald was home later that day.
Are you still comfortable?
Yeah, okay.
Patients are getting the care they need. For staff, it's relentless.
The people that are in red, that tells us they're coming up to the 4-hour breach time. It's not a nice working environment to be in.
As you know, we're on Opal 3, so this is...
Here in the major incident room behind me, it's 10 o'clock in the morning and senior management have gathered for a high-level meeting to work out their response. The hospital's moved to a higher alert status.
There's the issue in ITU with 7 level 3s, which has meant we've had to cancel 2 elective patients.
They call it Opal 3, the second most serious level of pressure.
Influenza cases have definitely risen.
Major breaches of the 4-hour A&E target.
We've got additional consultant shifts this evening and tomorrow evening, working till 8 o'clock to try and just help with flow.
Every part of the hospital has to work together to keep the patients flowing.
In terms of bed occupancy then?
We've got 7 empty beds. We have got 9 confirmed discharges through all of the medical wards.
Anything else we can do on beds at this stage?
They're constantly trying to avoid closing the doors to new patients.
I'm afraid at the moment we haven't got any beds available on the unit.
Right.
So we're waiting for people to either go home or be discharged onto other wards. We have days where it is busy, you know, we have nurses at their wits' end half the time.
What brings you to the emergency department today?
One new idea to relieve the stress is to have a highly qualified nurse at the front door. She sends the seriously ill straight to A&E.
This is not really an A&E or emergency department job.
And others elsewhere in the hospital, including a unit with GPs.
Sometimes it's difficult. Patients perceive what they come in with to be an emergency, but by doing a triage at the front door, checking what they've come in with, doing a set of observations, we can quickly recognise whether or not they need extra tests or not.
However hard the hospital's trying, a queue of patients is building up.
We train to treat people, we train to bring people to hospital, but not wait with them in the corridor and babysit them, for want of a better term. So, yeah, it's hugely frustrating that we're here and not out there treating patients.
But by early evening, more patients are on the move.
So that was a 4 out of 10 pain, it's now a 10 out of 10.
The hospital's alert level is later stood down.
He's just continuing to struggle with his breath.
Even under pressure, staff delivered good care to the sickest, like Mike,
Now look in the back of your throat. You say half of me.
who was rushed in with breathing problems.
Gonna pop a cannula in this side and take some bloods.
He recovered after a few days in hospital. What I saw over a few days, was a highly rated hospital stretched close to the limit, but coping only thanks to the professionalism of doctors, nurses, managers and so many others.
I love it and I hate it. It's one of those, but the good days outweigh the bad days.
The NHS is living right on the edge. There's a new plan for change. It needs to work.
Our health editor Hugh Pym reporting there, and later this week Hugh will look at how the Royal Bournemouth Hospital is working with others to encourage people not to go to A&E unless it really is an emergency.